Hey guys, welcome to another episode of the Dental Review Guy. Today we are going to be reviewing the Artex Facebow. So this is a really solid Facebow, very nice German construction, or maybe it's Austrian construction, that may be more accurate. But it's really rigid construction and it works really well. So it is an earpiece type of Facebow. I'm happy that there's no spring mechanism over here, so that works really much better. And there is a Nasion relator over here, which is your typical third point of reference. That works pretty well. And when it comes to the actual transfer assembly, it's this thing which is a very unique structure. It's called, I think they call it the 3D mounting system. I'm not exactly sure what it's called, but you tighten with this. There's no screwdriver involved. You just have to tighten with these, and this makes it really convenient. So any three-dimensional position can be achieved using this. So I really like the system. I think it's great. So now, how does this work? You put this into, you loosen these thumb nuts over here. You can put this into the patient's ears. You relate the Nasion point over there. This looks like that should be right. And then finally, we have to get this into the bow, and we tighten that. And now this, of course, is going to go into the patient's mouth. So how do we do that? We have to attach this part, which goes into the patient's mouth, which is the bite fork. We tighten this. And now let's imagine that this is the ideal three-dimensional position for the patient. So now we have to tighten this. This, of course, once again, very difficult to do without a patient. Maybe someday we can make you some videos which show you how to do this on a patient, if there's any demand for it, so we can do that. And then finally we tighten, get that position in place, and that's the Facebow transfer. So once this is really tight, no screwdriver needed, so which is a nice advantage. You then just have to unscrew this, and that's your Facebow mounting. So, well, that's your Facebow transfer. We're going to make it a Facebow mounting. So in the Artex system, you have this. I've already pre-made this, but what needs to happen is this jig over here, which you use. You have to, let's get this off for convenience sake, and we have to introduce, none of this is anatomical because we just did it with an imaginary patient, so I'm just going to loosen it up over here, and I'm going to get this part in over here and kind of get this into a convenient position for demonstration purposes. So something like that. And this is the next part of it. So actually you would not have these two plaster, you would have these removed. But in that case, you would then mount this on top over here, on that, place this over this, there you go, tighten the screw again. And remember, this has some compound or some PVS material over here, which are then going to mount your maxillary cast. So you have this record over here. Once this is done, you can unscrew this thumb screw, take this whole contraption to your articulator, and then you bring it in like that, place it in, and now your maxillary cast goes on, and you can then articulate. Of course, this is all imaginary, so you see things kind of hitting places where they shouldn't be, but generally this is how it works. You would place your maxillary cast here, flow some plaster over here, and you would then have a nice Facebow recording. So that's how the Artex system works. So I like this system. I use it nowadays for all of my full arch reconstructions. I feel it gives me a lot of accuracy. I'm very confident with this Facebow. I know that I'm not going to have any sort of inaccuracies. One of the things about the sliding mechanism that I don't like is, you know, when you're introducing it into a patient's ear, it's kind of hard to know exactly how much you should introduce, so you kind of wait till you feel a little bit of resistance and then you stop, but then the patient tells you, hey, it's not all the way in yet, so you may need to push a little bit more. With the spring type, or with the type with the Panadin, has a similar issue, but I feel like because this earpiece lobe, or this earpiece module, if you would say, is smaller, I think it's a little bit more technique sensitive when introducing it into the patient's ears. But I haven't had any complaints, so it's fine. All in all, this may be, on a scale of 0 to 10, I would probably give this an 11. How about that? So here's a real score for you guys. So I would say the Artex Facebow is a good buy, especially when it's complemented with the Artex CPR articulator. So till the next time we meet, this is the Dental Review Guy, Dr. Varun Acharya, signing off with a smile.